So hello friends, let's revise few important points regarding wound healing quickly. So what are the stages of wound healing? Hemostasis, inflammation, proliferation, and the last one is remodeling. So let's talk about few points regarding the wound strength also. So it takes almost 1 week to regain its 10% of the strength, and it takes almost 3 months to regain its 70 to 80% of the strength. It will never get back to its original strength. So what is the important vitamin that takes place in wound healing or crucial role in wound healing? That is vitamin C. Now what are the types of collagen that takes place in wound healing? So as I can say, that is type 3 collagen in the proliferative stage in atypical manner, and type 1 collagen in the remodeling phase organized manner, in an organized manner, right, takes place. So wound healing occurs by primary intention. So what is primary intention? That is, if the wound is surgeon's made wound, in cases of surgeries like breast surgery, thyroid surgery, uncomplicated hernia surgery, where there is no inflammation present. So the wound will be more precise, edges will be more approximated, there will be no inflammation, so there will be less chances of contracture, granulation tissue formation, less chances of the it will facilitate more, less scar will be there, and it will facilitate what now healthy wound healing and faster wound healing, we can say. Now moving to the secondary intention, wound healing occurs by secondary intention also. And what is that? That is there will be chances of more less approximated edges than before, and inflammation may be present there, so more chances of contracture formation, more chances of granulation tissue formation, and more chances of the scar formation, and it will lead to what? Not delayed wound healing. And last one is tertiary intention or delayed primary intention, you can say. So inflammation is always will be present there. So if there is any pus formation or something is there, and the edges will be more far, or the edges will be not approximated there, so the surgeon will do what? Now keep the place open, and when the edges will be more approximated than before and it will come near, then the surgeon will suture the place, right? So it will lead to what? Now more granulation tissue formation, more scar, more chances of the contractures than secondary intention also, and it will lead to what? Now delayed wound healing also. Now what are the types of wounds? Clean wounds, clean contaminated wounds, and dirty wounds, right? Now next part I will discuss about the surgical site infection. Stay tuned.